So welcome, everyone. Sorry for the technical glitch, but we should be able to cover all of our material related to brain health, the role of nutrition, vitamins, and supplements. As you can see, I'm a professor in the Division of Geriatric Psychiatry in the Department of Psychiatry at SLU. Go to our next slide.
With the honor of the Black
Sure. I'm at one of our
Z, with the slasher and the main entrance.
Sorry about that. I'm at one of our teaching nursing homes, and they have a overhead announcement. These are my disclosures. Most of the work that's on here, I do with pharma to help develop new treatments for Alzheimer's disease. I'm going to go to our next slide. All right, so we're going to talk a bit about mechanisms that connect dementia and nutrition. We'll talk about the relationship between dietary intake and brain health. I'm going to share with you something that we've published, which is 10 steps to promote brain health. We'll talk about resources and then end up with some conclusions. All right, so let's start with mechanisms of cell death and how they relate to kind of nutrition and dementia. I think you're all aware of the fact that neurons or brain cells die in Alzheimer's disease. And there's a whole variety of reasons why the neurons die. Some of them are listed here. Oxidative stress, free radical toxicity, inflammation, impaired glucose utilization, poor blood flow and oxygen supply. So some of the things we'll be talking about try to address these mechanisms. And there are a variety of things in foods, nutritional components, things like curcumin, anthocyanins, and sulforaphanes in different vegetables and so on that we'll be talking about that can counteract these processes. So there's what we call a synergy between nutritional things or components that may improve neuronal plasticity or viability, and of course, brain function. A lot of the data for this comes from animal studies or epidemiologic studies, large database studies. What we need to have are large prospective randomized placebo-controlled trials over many years, but that is very difficult to do and of course, very expensive. Next slide, please. All right, so there are a variety of foods that we talk about and think about as promoting brain health. So for example, a variety of fruits and vegetables and legumes have phytonutrients, which are both anti-inflammatory as well as antioxidant. And these may in fact protect brain neurons or serve to protect brain health. The current recommendation is 5 to 10 servings a day of fruits, vegetables, and legumes that have these phytonutrients. Now, most people don't get anywhere close to that, but if you look at the Mediterranean diet or the MIND diet, this is what they in fact, emphasize. There are a variety of kind of superfoods like berries, which have polyphenols, which may in fact improve cognition, which have antioxidant properties. Sulforaphanes, vegetables like broccoli, for example, and tomatoes and green leafy vegetables have lycopene and folate. All of these things can be important for healthy brain function. And the more we eat of these products, obviously, the better. Next slide. What about omega-3 fatty acids, also known as kind of fish oil? So there are 3 types of omega-3 fatty acids. A lot of our patients, take omega-3 fatty acid supplements. There's DHA, which is 40% of the fatty acids in the brain, EPA, and linoleic acid. The most important is DHA, which promotes kind of communication among neurons and also has antioxidant and anti-inflammatory effects. So if you know of anyone that's taking a fish oil supplement, you want to make sure that the majority of the fish oil or the omega-3s are in fact DHA. There's also low DHA seen in Alzheimer's disease. Now, you could take a supplement, or just as good, if not better, is to eat products that are high in DHA, things like oily fish, things like salmon or mackerel.
Either black
Or mackerel, for example. But of course, we want to make sure that we're not frying fish, because then the frying process adds extra calories, not good for health. And we want to make sure that we're not consuming too much mercury, especially in women who may be pregnant. But there are other sources of DHA, walnuts, kiwi fruit. And then for people who don't like to take the fish oil kind of supplement, flaxseed oil is a healthy, often better tolerated form of omega-3 fatty acid supplement. There's been one large NIH-funded, randomized, double-blind, placebo-controlled study in Alzheimer's patients who consumed 2,000 milligrams a day of DHA versus not consuming them. But unfortunately, that was a negative study. It did not improve cognition or slow disease progression. So while omega-3 fatty acids are healthy and important in the diet, there's no guarantees that they're going to slow or prevent Alzheimer's disease. Let's go to our next graphic. Now, what about whole grains? This is something that's very desirable. It's good for all of us to be looking for whole grains. They have more nutrition and fiber than refined grains like white bread, white rice. And the whole grains are rich in the B vitamins. Of course, they also have more fiber and more antioxidants. The second bullet you see are examples of whole grains that are much healthier than the refined grains like white bread or white rice. And these include things like oats and wheat and barley, quinoa, bulgur, rye, kasha, and so on. If one is going to be purchasing pasta, for example, it's much better to get pasta with whole grain. If you're going to get bread, it's better to get whole wheat bread. If you're going to eat rice, eat brown rice. Again, these are healthier than the more refined grain equivalents. We also know that if you increase whole grain intake, it can lower blood sugar and decrease abdominal obesity. So how do we make sure we're getting whole grain? You have to make sure that on the label it says 100% whole grain rye, whole grain wheat, whole grain barley, so on and so forth. If it does not say that, then it's not whole grain. Next slide, please. What about monounsaturated fatty acids? We know that monounsaturated fatty acids may promote brain health and slow cognitive decline. They're a significant component of the Mediterranean and the MIND diet. Because of this, if we're going to be using shortening of any sorts, the healthiest shortening to use is extra virgin cold press olive oil. There are animal studies showing that extra virgin cold press olive oil alone may slow cognitive decline, at least in animal models. We want to make sure you don't do too much oil, as they have a lot of calories, but again, that's the oil to use. Other good sources of monounsaturated fatty acid would be canola oil, which is more affordable, and then avocados and avocado oil. Avocado oil tends to be very expensive. Let's go to the next slide. So what about spices? You've heard a lot about turmeric. There is some evidence that turmeric, or the active ingredient curcumin in turmeric, which is also found in the spice curry, seems to have anti-inflammatory effects and may even have anti-amyloid, which is the amyloid plaque in Alzheimer's disease effect. So we actually do recommend a curcumin supplement, you see in the third bullet, Theracurmin, 90 milligrams twice a day, based on a study at UCLA showing that it may be good for improved memory and attention in at-risk older adults, not people with severe dementia, but people who have mild impairment or who are at risk. There's less evidence for cinnamon and cloves and ginger, garlic. There are a number of other spices that have phytonutrients which may be beneficial. But the best evidence so far right now is with curcumin, and that's what we recommend. It may be the reason why that in Asian diets, where they're using a lot of curry every day, almost every meal, there may be a lower risk of Alzheimer's disease versus countries like ours, where we don't consume a lot of curcumin. Next slide. What about nuts and green tea? So if we're going to be recommending nuts, keep in mind nuts have a lot of calories. So the recommended daily amount is a handful of tree nuts per day. When you consume more than that, then the calories really build up. But the richest source of omega-3 fatty acids are walnuts. So walnuts would be the nuts of choice. Almonds are also good because they have vitamin E. And most tree nuts do have monounsaturated fatty acids, which are good for brain health. Keep in mind, this is tree nuts. Green tea is also something that may be useful. It has a high content of catechins. Catechins are antioxidant. They're also anti-inflammatory. But let's keep in mind that tea has caffeine, not as much as coffee, and that high doses of caffeine can be a problem, especially for some older adults. Also keep in mind that green tea, with its caffeine content, can yield false positive laboratory findings for certain cancers. But green tea has been used in many parts of Asia as a way to promote brain health, and there may be something to that. Next slide, please. So what about coffee and dark chocolate and artificial sweeteners? There are a number of studies that have shown that regular coffee, not decaf, regular coffee consumption may actually decrease the risk of not just Alzheimer's disease, but also Parkinson's disease and diabetes. We want to keep in mind that if you put sugar and cream in your coffee, that may negate any benefits because of increased lipids, increased calories. And we want to make sure that people are not drinking too much coffee. Maybe a couple cups a day. When you drink too much coffee, we worry about the side effects of too much caffeine, which include anxiety, insomnia, hypertension, arrhythmias, tachycardia, so on and so forth. So we want to use coffee in moderation. What I usually tell my older adult patients who like to drink a lot of coffee is that if you like coffee in the morning with breakfast, maybe have 1 or 2 cups of regular, but after that, switch to decaf. Now, what about chocolate? The only evidence we have for the benefits of chocolate, which is fairly good evidence, is for dark chocolate. So the more pure dark chocolate, 70% purity or greater, is what we recommend because it can lower low density lipoprotein and maybe decrease the risk of atherosclerosis. So dark chocolate may benefit the heart, may be good for brain health. But of course, we want to worry about saturated fats and refined sugars and high calories, which are all bad for the heart and bad for the brain. Unfortunately, most people don't consume pure dark chocolate. They basically consume milk chocolates, which are very rich in calories and other things that are bad for the heart, saturated fat and so on, also bad for the brain. What about the artificial sweeteners? So we all know individuals who are using artificial sweeteners, whether in diet colas or drinks or putting artificial sweeteners into coffee or tea or other liquids. Often they're eating a lot of calories and they're trying to expiate their guilt for eating too many calories by using an artificial sweetener or, taking that huge meal in with a Diet Coke or a Diet Pepsi or whatever it may be. Generally speaking, use of artificial sweeteners increases weight, does not cause weight loss. And the reason it does that is that they're very sweet, and it causes the individual to crave sweet things. And because of that, they in fact eat more sweets and gain more calories and gain more weight too. Next slide, please. What about alcohol? So one of the things I tell my patients, my older adult patients, is that in medicine, we are not anti-alcohol. We are anti-alcohol abuse. We are anti-alcohol in excess, but very modest alcohol intake, which is, by the way, defined as 1 drink a day for women and 1 to 2 drinks daily for men, has been associated with reduced risk of Alzheimer's disease and may even have some cardiovascular or heart health benefits. However, if I have an older adult who's not been a drinker, who reads about this, that alcohol might be a good idea, and they want to start drinking for the first time in later life, we do not encourage that they start drinking for the first time in later life. In fact, our older patients that have memory issues, we recommend switching to non-alcoholic beverages. And everything has a non-alcoholic equivalent. I had a patient this week who was a wine drinker. We switched him to non-alcoholic wine. Somebody drinks beer, you can switch to the non-alcoholic beers. If they drink a cocktail, you could have a mocktail instead. So if an older adult's already beginning to show memory problems, the recommended amount of alcohol intake is 0. And often by taking them off of alcohol, their memory and their cognitive functions may in fact improve. Next slide. So what about medical foods? What are they? So a medical food is an FDA approved, Food and Drug Administration approved substance for dietary management of a disease or a specific condition. These do require a prescription. One example of it is the medical food Axona, which is available in the US. In Europe, they have a substance called Suvinade, which is a kind of a memory shake. It has a variety of amino acids and vitamins and so on. Axona, as you see here, is a blend of free fatty acids, which are converted to ketone bodies and may be able to serve as an alternate source of fuel to glucose for neurons. The data is not very strong with Axona, but it is available in the United States. Suvinade is not available in the US, but is available in Europe. I would not recommend these on a routine basis until we have better data. Next slide, please. What about vitamins and supplements? So the next few slides come from these references. The Essential Herb Drug Vitamin Interaction Guide, Nutrition and Nutritional Supplements to Promote Brain Health, and our Psychiatric Consultation in Long-Term Care. We're working on the 3rd edition of that. Next slide, please. So we all talk about vitamin D, D as in dog, which we know helps to maintain normal calcium and phosphorus levels in the blood. We know that deficiency increases risk of falls, hip fractures, even mortality. And there's more and more data that vitamin D deficiency may be associated with cognitive decline in later life, as well as with depression in later life. We know that older adults, probably the majority of them, are deficient in vitamin D, especially if they live in long-term care, mostly because they don't consume a lot of dairy products that are fortified with vitamin D, and a lot of older adults are not sun worshipers. They're worried about skin cancer. So they don't have the 2 major sources of vitamin D intake. Now, sources of vitamin D intake would be things like oily fish, like salmon, egg yolks, and then particularly the fortified dairy products and certain cereals. About 15 minutes of daily sun exposure are required as a major source of vitamin D exposure. So I think it's very important to always check vitamin D levels in our older patients, even if they're not having cognitive or mood-related issues, and if they're low, to supplement them with vitamin D, which is available over the counter. Too much vitamin D can cause hypercalcemia, which can make cognition worse. Also can cause, kidney stones and so on. So it's important to track calcium levels. Next slide, please. What about B12? We know that B12 is a very important vitamin. It aids in the synthesis of new neurons and helps improve neural connections. It's good for red blood cell production, decreases homocysteine levels, which are a potential risk factor for Alzheimer's disease. It's very common for older adults to be deficient, not because they're not eating well-balanced meals, but because they're not absorbing B12 from the gut because of a deficiency of intrinsic factor. We usually treat vitamin B12 levels that are under 400. So don't look at the lab value that says that anything over 200 picograms per milliliter is normal. If it's under 400, I would already treat, because if you wait 12 months, it might be 250 and so on. We know that low B12 can contribute to depression, to psychosis, even to delirium, before we see the anemia, the megaloblastic anemia. And of course, B12 deficiency is often described as one of the potentially reversible causes of dementia and is an important part of the routine dementia workup. You could treat it with sublingual or oral or injectable, even inhalable forms of B12. Next slide. What about folate? What about folic acid, also called folacin or vitamin B9? Folate deficiency is quite uncommon. We do check that as part of our routine kind of dementia workup. May contribute to depression and cognitive impairment, may elevate homocysteine, which can be a risk factor for Alzheimer's disease. Very easy to treat with 1 or 2 milligrams of folate. There's some evidence that recommending a B complex multivitamin, which includes folate as well as B12 and the other Bs, may actually lower the risk of Alzheimer's disease and may have some cognitive benefits. So we do recommend for our older patients to take on a daily basis a B complex multivitamin. Keep in mind that folic acid supplements may exacerbate pre-existing B12 deficiency, so it's important to check B12 levels before supplementation. Next slide. What about B1, thiamine? Thiamine deficiency is very, very uncommon in Alzheimer's patients or in general in our society. Where we see it is in individuals who have alcohol abuse, sometimes with diabetes. We know that deficiency can cause neuropathy, Wernicke-Korsakoff syndrome, which is a significant dementia with psychotic features. B1 or thiamine deficiency induces oxidative stress, increases inflammation, and may actually accelerate the deposition of plaque in Alzheimer's patients. Very easy to treat. In our individuals, they have a history of alcohol use disorder or significant alcohol use. We routinely put them on 100 milligrams a day of thiamine, and that's a good idea. Next slide. What about niacin? In other cultures, kind of more emerging countries, poor countries, there's pellagra, the accompanier LDL. These are all good things and elevate the bad cholesterol, the HDL, which is also a good thing. But we want to keep in mind that there is a little bit of evidence that disease, but we don't routinely give it complex multivitamin because that's part of that. Next slide. What about B6? Pyridoxine. Again, deficiency is pretty rare. It is important for brain function. Mostly, again, you get sufficient amount taken daily. Next slide. Now, what about E? So there is a large world study that was done. They had 560 patients, mild to moderate Alzheimer's disease, and they were either supplemented with 2,000 units a day of vitamin E or placebo, followed for over 2 years. And again, it did show that there was a slowing in the rate of decline, in particularly activities of daily living in those that were on vitamin E. There's no evidence that vitamin E prevents Alzheimer's disease or helps people with the mild cognitive impairment due to Alzheimer's disease. So we would ordinarily recommend units a day, except there's evidence from the Women's Health Initiative study that higher doses of vitamin E, at least in that population, may increase mortality. This was in people who were at risk for Alzheimer's disease, but who didn't have it. Patients who already had Alzheimer's disease, if you gave them high dose vitamin E, it did not increase mortality. There's some association with increased risk of falls and bleeds. So we have to be careful with patients on anticoagulants. So what a lot of people have been recommending is another very potent antioxidant, which is maybe less controversial, and that's vitamin C. Using vitamin C at maybe 500 milligrams a day may not be a bad idea, but again, no guarantee to prevent Alzheimer's disease. Okay, can we go to the next slide? What about vitamin C? As I mentioned before, it's a potent antioxidant found mostly in fruit juices, very rare to have deficiency. We do know that high levels of vitamin C and beta carotene may actually have some protective effects, may dissolve the toxic protein aggregates in animal models of Alzheimer's disease. But keep in mind that high doses of vitamin C can increase the risk of kidney stones. So we want to not overload on vitamin C, but it may not be a bad supplement to recommend. Next slide. What about omega-3 fatty acid supplements? We touched on this earlier. We talked about how DHA is the most important, and that's what you want. That's the form of omega-3 that you want. We generally don't recommend them routinely unless it's an individual that doesn't have any intake of either seafood or flaxseed oil, or a supplement may potentially improve weight and appetite. The cardiovascular benefits of omega-3 fatty acid supplementation are being questioned at the present time. Optimal dose would be 500 to 1,000 milligrams of DHA in divided doses, maybe a couple times a day, divided doses, because it can cause abdominal discomfort, very mild increased risk of bleeding, but nonetheless should be used cautiously in patients on anticoagulants, and usually held for a couple weeks before surgery because of the mild bleeding potential risk of bleeds with the omega-3s. Next slide. Now, ginkgo biloba, memory solution, memory formula, Prevagen. We are writing a paper on this right now. We've identified 42 over-the-counter memory aids. Almost all of them have ginkgo as a significant component. Ginkgo is consumed particularly all over Asia to try to prevent Alzheimer's disease and improve cognition. There have been studies in the US. The evidence to date, the randomized placebo-controlled studies do not support the use of ginkgo in preventing or delaying or treating dementias of any sorts, including Alzheimer's disease or mild cognitive impairment, or those that already have, Alzheimer's disease of any complexity or any severity. We do want to keep in mind that ginkgo can increase the risk of bleeding. We've had a number of patients, even without anticoagulants. I had a gentleman not too long ago who had microscopic hematuria. But the reason wasn't because he had a bleeding diathesis or that he was on anticoagulants. It was that he and his wife were both taking memory formula with significant amount of ginkgo. After a several $1,000 urologic workup, it dawned on us, we weren't the ones that did the workup, it was done by his primary care physician, that he didn't need to have any further workup, that the culprit was ginkgo. And we stopped the ginkgo and the microscopic hematuria disappeared. We usually stop this before surgery as well. Next slide. What about other supplements? So when you look at these over-the-counter memory aids, like memory formula, Prevagen, and so on, they also contain a lot of these different ingredients. Most of these ingredients have not been studied, almost all of them in a randomized placebo-controlled fashion. A lot of them can have side effects. These are some of the things that you see in these memory formula preparations. Some of them don't do anything at all. They're totally negative and may, in fact, increase the risk of bleeding, may lower blood pressure, especially in patients who are already on antihypertensives. So we generally don't recommend that people go out and spend money on these memory-enhancing over-the-counter supplements. Next slide. We do recommend there's a variant of the Mediterranean diet. The Mediterranean diet, there's more and more evidence, controlled studies, has benefits for the heart, for the cardiovascular system, as well as for the brain. What we're talking about is high intake of fresh fruits, fresh vegetables, whole grains, cereals, legumes, unsaturated fatty acid like in olive oil and oily fish, and a low intake of saturated fatty acids, such as red meat, particularly poultry in moderation, low to moderate intake of dairy products. You want to consume the low-fat dairy products whenever possible, and moderate intake maybe of red wine or alcohol consumed with meals. Keep in mind, moderate, 1 drink a day for women, up to 2 drinks a day for men. These have been, the Mediterranean, the MIND diet, have been associated with a lower risk of Alzheimer's disease and mild cognitive impairment. This diet may also improve levels of cholesterol, lower blood sugar, some evidence in animal models of increased longevity, decreased risk of obesity, diabetes, stroke, and heart disease. And as you can see here, there are many different mechanisms of action whereby the Mediterranean diet may present benefits for both the heart as well as the brain, so it's highly recommended. Next slide, please. So this is the DASH diet, which is also a recommended diet for individuals who have hypertension, which is similar in some ways to the Mediterranean diet. The MIND diet brings the two together. So it's basically the Mediterranean diet, but low sodium. We have a huge problem with obesity in our culture, and we have a huge problem with too much salt, too much sodium. So this particular diet tries to moderate the amounts of sodium, low sodium, which is good for blood pressure. And then together with the components of the Mediterranean diet, may promote brain health via high antioxidant properties. So these are things that we recommend for all of our patients. Next slide. So this is the MIND diet I just referred to, which is basically the Mediterranean diet together with the DASH diet. Again, there's evidence showing decreased risk of Alzheimer's disease, slowing cognitive decline even after stroke, decreased 12-year cognitive decline in older adults in a large Australian study. And there have been systematic reviews, again, confirming the benefits of the MIND diet. So this is what we recommend, which is basically the Mediterranean diet together with a low sodium intake diet as well. Next slide. What about the ketogenic diet? This is receiving a lot of attention. It's quite popular these days. We actually, just a few months ago, published this paper in the Journal of Nutrition, Health, and Aging, where we looked at what evidence is there that the ketogenic diet is healthy and is a good idea for our older patients, particularly who want to avoid Alzheimer's disease, or even if they have it, to maybe decrease the rate of cognitive decline. What we're talking about here is a high-fat, low-carb, I mean really low-carb diet, which has fasting-like effects and brings the body into a state of ketosis. It's thought that the presence of ketone bodies may have neuroprotective effects and may enhance mitochondrial function, may reduce inflammation, may help kind of protect kind of neurons, and may serve kind of as an alternate source of energy to glucose. Unfortunately, we don't have any long-term controlled studies showing benefit. There are only small, very, very small studies that show a potential benefit, and we need to worry about the long-term consequences, particularly exacerbating diabetes in patients who have diabetes that may not be well controlled. So the bottom line is we are not recommending the ketogenic diet for our older patients. Next slide, please. All right, so what are the strategies that we do recommend to promoting brain health? So this has actually been published by Dr. Desai and myself previously. We called it the 10 steps to promote brain health. Obviously, when you see a new patient, young or old, good idea to do a comprehensive evaluation of nutritional status. So I'm a big believer in getting our dietary folks involved, not just in long-term care, but in general, to evaluate what the dietary needs of the particular individual are. We're always promoting a balanced diet. We're always recommending for our older patients that the food be appetizing and be healthy. Appetizing is not easy to do because a lot of patients, can't have salt or can't deal with spices. But generally, I'm in a teaching nursing home right now. When you talk about patients in long-term care, we worry more about intake. We want them to have foods that they enjoy. We recommend that the family bring in favorite foods from home. We recommend that they bring in favorite foods from restaurants and so on to make sure that they're eating enough. Fruits and vegetables, really need to prioritize those together with the whole grains. Fish, particularly fatty fish, maybe 4 to 5 servings a week would be a good idea. A handful of tree nuts, particularly walnuts every day. We do have evidence with turmeric, with curcumin. And then we know that our older patients often do not drink enough liquids. They don't drink enough water. They get dehydrated, their blood pressure drops, their electrolytes get out of whack, they develop more orthostasis, they're at increased risk for falls and hip fractures. So we want to make sure that we're really pushing liquids on a regular basis. 4 to 12 ounces of green tea might also be recommended. If the patient enjoys that, that's a good idea. Similarly, kind of low intake of coffee. Next slide, please. We want to reduce intake of foods which are bad for the heart and bad for the brain. These generally will be like fast foods, foods that are high in the, not the unsaturated, but the saturated fatty acids, foods that have a high caloric value, but have very little nutritional value. As people get older, we're really recommending maintaining a decent weight, but we're now pounds in someone who's 85. More rather than big meals, couple 3 times a day are ideal with optimal caloric intake to maintain healthy weight. Variety in foods is also desirable. Getting an individual kind of like food diary for each patient. What are mom's or food medical condition, I should say, interactions? We want to be quite proactive in dementia patients who are starting to lose weight. As soon as we begin to see a pattern of weight loss, we want to treat aggressively and early with high protein supplements. If we don't do that, those patients go downhill very, very quickly. Keep in mind too, that again, especially with Alzheimer's disease, there's a blunting of thirst response. So we need to be constantly having liquids around, constantly encouraging fluid intake for all of our older patients, but particularly those with Alzheimer's disease. And of course, we want to introduce changes gradually. Next slide, please. Now, I want you to be aware of a relatively new website, less than 12 months old, which is fda.gov/dietary supplements. Up until recently, the Food and Drug has been accused of not paying any attention to these dietary supplements, not regulating them for safety or what kind of claims, the manufacturers can make. We still have a ways to go, but I think this website is one that I would refer patients to that will explain what the dietary supplements are, what are their benefits and risks, how are they regulated, and how do you become a safe and informed consumer, why it's important to report adverse events from foods, from supplements that are even available without a prescription to the Food and Drug, so they can begin to regulate the claims that these supplement or dietary supplement manufacturers often make that don't have evidence to back them up. Next slide. So let's kind of finish up and we'll have some time for questions. So proper nutrition and vitamins and supplements, we think are important for brain health and maybe in prevention of brain disease. We're not sure, but again, there's no downside to proper nutrition. We think that healthcare providers need to be probably more knowledgeable about nutritional recommendations, especially for older patients, particularly things that are good for brain health. We do think that proper nutritional advice may play a role in slowing cognitive decline, but especially when combined with lifestyle modification, such as exercise, physical exercise, mental exercise, social and spiritual activity, mindfulness and stress reduction, and control of cardiovascular risk factors, things like diabetes, hypertension, obesity, hyperlipidemia, and smoking, huge risk factor for Alzheimer's disease, as well as cardiovascular disease. I do believe that our dietary consultants really play a vital role. They're an important part of the healthcare team in dealing with nutrition and brain health issues, as well as cardiovascular health issues in our older patients and their families. that I think is my last slide. So sorry for the delay. Thank you all very much. I'm happy to have comments or questions.
I have a question. My name is
Yes.
Sadia. I'm a second-year family medicine resident in Kirksville, Missouri. As far as like the dietary recommendations for like the Mediterranean diet, or even at the end where it said 2 to 4 servings of fish, or even for the fruits, does it matter if it's frozen or not, or does it need to be fresh?
Yeah, so ideally, fresh is better, but frozen is not quite as recommended because you lose some of the nutrients, but next to fresh, frozen. Okay, what we don't recommend, obviously, are taking vegetables and boiling the heck out of them or mashing them up after you've boiled them. You lose a lot of the nutrients. So the ideal is fresh fruits and vegetables, fresh produce, fresh fish, to get the most nutrients. But fresh frozen is nearly as good and would be recommended. Yes.
I had another question. So you mentioned also with like the fish, frying it, you lose some of the nutritional
Well, you
value. But
gain
what if
bad fats by frying. So it's better to grill or to ideally, to not barbecue them, but to roast, not to fry them in oil. Any other technique other than the typical example is we have them here in St. Louis are the fish fries. Every Friday, before Lent, churches and other organizations have Friday fish fry. The fish that they use, maybe fine. It could be one of the healthier fish, maybe fresh frozen. The bad part is then they throw that fish into a deep fryer, often of unhealthy oil. And the fish are oily because of the oil, and they have a lot of calories. So some of that offsets the nutritional value. So broiling or grilling is better than frying in oil.
What about air frying?
Air frying is much healthier, yes. But not everybody has an air fryer. And I find a lot of our older patients don't have them. Most of them have never heard of air frying. My son, who just moved into a new condo, first thing that he bought was a toaster oven with an air fryer. So he knows what it is.
Thank you.
Thank you. Any other questions or comments?
Dr. Grossberg, do you have any comments on the importance of fiber to promote short chain fatty acids in the gut? They seem to have a role in brain health.
Yeah, so we do recommend fiber for that reason as well. We also recommend fiber for good bowel health. A lot of our older patients obviously have significant issues with constipation. While I'm on bowel health, because fiber is important for good bowel health, and you can get that in various vegetables and cereals and so on. Let me just share with you one factoid about bowel health. We had a grand rounds just about a month or so ago, and I'm sure you guys may know her, was the current acting director, Angela Sanford of geriatric medicine. And one of the facts that she shared with us is that every year in the United States, mostly older adults spend over $100 million annually on stool softeners, like Docusate, which is the most common one. And there have been now study after study after study, controlled study showing that they are totally ineffective. So don't prescribe those stool softeners. What she recommended was polyethylene glycol, also known as Miralax, and there are other options too. But nutritious diet with adequate fiber is definitely a good idea for that reason as well. Thank you for asking that.
Thank you.
Yeah, other comments or questions? So that might be it, Ms. Brockett.
Well, thank you so much. It was very interesting.
Thank you for
Do we-
Really enjoyed it,
figuring
so
out the
appreciate it.
slides.
Do we
No
have
worries.
access to the PowerPoint?
Oh,
Do
we
you,
should look at the
um,
chat. I'm reminded that no
There's no
questions in the
questions in there.
chat,
Nope.
but you
Nope.
can fill out
Um,
your forms.
Right. Do you mind if I send the PowerPoint out, Dr. Grossberg?
No, that'd be fine.
Okay,
Thank you so much.
you are welcome. I'll actually send
Yeah.
it to probably Debbie Dar and you can get it from her. Is that okay?
Yes, that works out perfectly. Thank you.
Okay, perfect. Uh-huh.
All right. Thank you, guys. Have a great day.
Thank you so much. Appreciate it.
Yeah, thank you again for the slide help.
No
I'll
problem.
have to check my computer. All right, stay
All right,
well.
sounds good.
Take
All
care.
right, bye-bye.
Bye-bye.